African medicine. Although Africans and people of African descent are seldom given credit in standard textbooks, African wisdom contributed greatly toward the development of modern medicine. For example, in Western Africa during the Songhai Empire, about 1457 AD, when Europe was still in its dark ages, the city of Jean had a medical school which employed hundreds of teachers and was world famous for training surgeons in difficult operations such as cataract surgery. They also taught the pharmacological use of over 1,000 animal and plant products for treatment of medical illnesses. Many of the same medicines in pill or liquid form are used today. For example, castor seeds, the source of castor oil, was used for constipation, and castor oil is still used today. Kaolin was used for diarrhea and is still used today in kaopectate. Night blindness caused by vitamin A deficiency was treated with ox liver, which is rich in vitamin A. Vitamin C deficiency was treated with onions, which have a high vitamin C content. The antibiotic penicillin, produced by Penicillium mold, and its therapeutic properties were well known by the ancient Egyptians, who far exceeded the rest of the ancient world in medical knowledge. However, the presence of the antibiotic tetracycline appears only in the bones of farmers from the northern Sudan about 1,500 years ago. The ancient Sudanese farmers discovered that Streptomyces molds can easily produce tetracycline on stored grain and purposefully used tetracycline to treat infection. There is no evidence that tetracycline antibiotic has been used anywhere else in the world. Tetracycline was not rediscovered until the 20th century. More than 40% of modern pharmacological medicines are derived from traditional African medicinal herbs. For example, the Yoruba of Nigeria used the plant Rowolfia vomitoria as a sedative or tranquilizer to calm agitated or psychotic patients. Modern medicine was able to isolate a substance called respirin from this plant that was marketed for the same purpose. Respirin was also discovered to profoundly lower blood pressure and consequently became one of the anti-hypersensitive medications. In America in 1721, an African slave named Onesimus taught his master an age-old African technique for smallpox inoculation, in which a pustule from an infected person was ruptured with a thorn and then used to puncture the skin of a normal person. Subsequently, during a smallpox epidemic in the Boston, Massachusetts area, Dr. Boylston inoculated 241 healthy people by this African technique, and only 6 caught smallpox. During the American Revolutionary War, General George Washington ordered his entire army inoculated against the smallpox by this African method. In the 1790s, the British Dr. Edward Jenner only changed the African smallpox inoculation technique by using a less dangerous kind of smallpox germ. Finally, as recently as 1880 AD in Europe, the mortality rate was almost 100% for mothers delivering their babies by cesarean section, that is, delivering babies to the abdomen. Consequently, the operation was only performed to save the life of the infant. Dr. R.W. Felkin, a missionary, shocked the European medical community when he published in the Edinburgh Medical Journal in 1884 that the Banyoro surgeon in Uganda performed cesarean sections routinely, without harmful effects to the mother or the infant. A group of European surgeons went to study in Uganda for 6 months before they could successfully learn the advanced surgical techniques demonstrated by the Africans. The Europeans were also taught sophisticated concepts of anesthesia and antisepsis. For example, they were taught to routinely wash the surgeon's hands and the mother's abdomen with alcohol prior to surgery to prevent infection. This antisepsis technique had not been practiced in Europe prior to this African visit. In summary, Africans have contributed greatly toward the development of modern medicine and deserve to be better acknowledged in our medical schools and textbooks.